This is the Brain Over Belly podcast, solving the puzzle of obesity with Dr. David Brown of Idaho BMI. Did you know that the most common first symptom of heart disease is sudden death? That's why prevention is so important. Today, Dr. Brown explains what you need to be doing now to keep your heart healthy. Here's your host, Rick Dunn.
Welcome back for part 2 of our deep dive about heart disease. Dr. Brown, thank you for being here again. Good to see
be here,
you.
Rick.
Yeah.
Congratulations.
I'm a married man.
You are indeed. Good for you.
Thank you. I appreciate that. So in our last show, we talked about taking a wider look at what causes heart disease. Super interesting. You got comments? You want to reiterate some things really quick? What are your thoughts?
Sure. Just a one-sentence summary, really the 12 steps to a heart attack. It's really all about this overwhelming chronic chain reaction of inflammation. That's what's driving heart disease.
And heart disease, I mean, a couple things that I learned, that is the number one cause of death.
Yep. In America.
In America.
Every year, has been for a long time.
And this was really interesting to me. The number one symptom of heart disease is death.
Sudden death.
Sudden death.
Yep.
It's over right then. So
right. The most common first symptom, the person hasn't had chest pain, they haven't had a heart attack, haven't had everything. The most common first symptom is sudden death.
Which it's obviously too late at that point.
Right.
So today we want to dig into treatment and prevention. Let me ask you this question. Is modern medicine missing the mark on that stuff right now?
Well, we are primarily focused on treatments for heart disease after it is already set in.
Right.
After a person has had symptoms already. And again, in recognizing that, we also recognize that we're missing roughly 50% of people whose first symptom was death.
Right.
So too little, too late. And in part, it's just the way we've been trained and our education and the way we've been taught to think about it. So
you're saying, yes, maybe missing the mark a little bit.
Okay.
We could do better?
All right. Yes, we definitely could be doing better. I don't think anybody would disagree with that. We need to understand the whole process, that whole chain reaction better, and how to change things much earlier.
So prevention is the key. That's the focus.
Yeah.
That's what we want to talk about, why prevention when it comes to heart disease is a big goal for us. How can we achieve that?
So modern medicine, we are focused on treating heart disease after it's already developed. So a lot of people think that putting in stents and doing open heart surgery, doing a bypass, that it extends people's lives significantly. And the truth is, it doesn't. And I should be clear here, there are really two categories of heart disease or coronary artery disease. One is what we would consider stable. So these are folks who have heart disease that it's not advancing quickly. The other is unstable coronary artery disease. Someone who's having a heart attack, we're having rapid progression of those symptoms.
Yeah.
In the folks with stable coronary artery disease, there have been some big studies in the last 2 years that have shown that in those people with stable disease, putting in stents, doing open heart surgery, doing bypasses, it doesn't extend their lives. Doesn't help them live longer.
So what's it doing? Or it's just making us all think we're it's a Band-Aid, right?
You could ask the question, well,
you don't want to say the politically incorrect thing? Is that what you don't want to do?
Why do we do it? So a lot of people are shocked by that in that very big category of people with heart disease, stents and bypass surgery doesn't really extend life. Now, in people with unstable coronary disease, it does. It will extend a person's life.
Gotcha.
So either way, I mean, we're behind the ball. That's the bottom line. And again, nobody would argue with that. We need to understand the whole process better and know how to prevent all of it.
People are still dying.
Yes.
And that's not getting any better.
We're missing half of them right off the bat.
So preventing heart disease, that's the goal.
Yes.
Okay. How do we prevent heart disease? What do we have to do?
Well, first, I think we have a long ways to go to understanding really the chain of events driving the process. And we talked about it last time, but good argument could be made that the primary fundamental driver, or the first step, is this excessive oxidative stress. And again, just to review, think of rust. I used to drive by the bay on the East Coast, and you see the ships and you see the green and the reddish.
It's rust. Yeah.
It's from oxidation. Well, that same thing is happening in our bodies. And that's the first thing really that's going. And so
we have to reduce oxidative stress.
Yeah. And then there's a lot of things. I mean, oxidative stress, it's so intermingled and intertwined and interrelated to inflammation and insulin resistance. But yes, that's, I would say, the first thing. We need to lower the amount of oxidative stress in our bodies.
So how do we do that? How do we reduce oxidative stress?
Well, there are a lot of things. And last time we talked about this 12-step reaction.
Yeah.
There's a lot of stuff going on, and that's a simplification, what we talked about. But I think it's a fair
it really lets us know what's going on inside the body that leads to heart disease.
Yeah, I think that is the most likely sequence of events that is together the primary driver of coronary artery disease. So reducing oxidative stress, I would say that should be the number one thing that we're focusing on. And the number one way to do that would be to change what we're eating.
Okay.
Americans eat far too much sugar and high-carb food, and we eat far too much PUFAs, polyunsaturated fatty acids.
At first, I just thought you made that word up. But
I didn't.
You
Can't
didn't
take credit. That's a big umbrella of fats. You got saturated fats, and then polyunsaturated fats and monounsaturated fats. People have heard of omega-3s. These are good fatty acids. They're good. They're in fish, other sources, and yeah, we want those. But that's only one type of polyunsaturated fatty acids. And on average, Americans are eating far too many other polyunsaturated
I know I
acids.
am.
Yeah, vegetable oils, seed oils, fried foods. And, when we consume those things, at the time we consume them, roughly half of them are already oxidized, are ready to start doing damage. The other, PUFAs that are not oxidized already, they are fuel for that chain reaction. So very comfortable saying we need to lower the intake of that, as well as high-carb foods and sugars.
So food's number one on the list.
Yeah.
I mean, there's a bunch of things
question.
here, but that is the number one thing.
Yep.
What else? How do we reduce oxidative stress?
Fasting. I think we eat too frequently, and there's good evidence now that going without food, fasting, helps to lower oxidative stress. Studies show, last time we talked about that glycocalyx, that little frond-like, carpet-like protective inner layer of the arteries. Well, a person goes out and you eat a high-sugar food, you can tell that inner layer, that glycocalyx, the inner layer of the artery, it's damaged. It's significantly thinner within 2 hours of eating that high-sugar meal. It takes the body about 12 hours to repair that. So if in 3 or 4 hours we're eating another meal,
that's not long enough.
Right, especially if it's got sugar and these PUFAs in them, we never catch up. So, yeah, we want to fast.
So we've got food, we've got fasting. What's next?
I would say exercise.
Exercise.
And it's a bit of a paradox on this one that, you go to the gym or you go run. If you're exercising with some intensity, you're actually causing oxidative stress. When you lift weights.
Wait, I thought we didn't want to do that.
Well, again, way back we talked about it at reasonable levels, lower levels, it's a good thing.
It's good for us.
Yeah. And when we go and we lift weights, we're causing little tiny tears in the muscle.
Right.
And the body's response in repairing that tear is really good. That's how you build new muscle. Same thing with oxidative stress that, lifting weights, running, that type of thing, it does cause some oxidative stress, but the body's response to it helps the body become more resilient in managing oxidative stress.
It's like a different form of an immune system. That's So foods, fasting, exercise, and
drinking lots of water.
Water.
Yeah. Most people are dehydrated. It's estimated 70% are 70% of people are chronically dehydrated, and that does a lot of things. None of them are good. Makes people more anxious, changes some hormone levels, does a lot of things. But if we're interested in oxidative stress, I think there are studies that are good that suggest we need to be hydrating well to manage that.
So we're going over reducing oxidative stress. Foods, fasting, exercise, water. Next on the list?
Sleep.
Good sleep.
Oh, yeah.
It's important.
Yeah, if we're not sleeping well, if we go to bed late, we don't get enough sleep, that is one of the fundamental drivers of too much oxidative damage in our bodies. I've struggled a bit with sleep recently.
Not you.
Yeah. Yep, I have. And I even bought this thing called an Oura Ring to help me sort of troubleshoot that a bit. But yeah, sleep is very important. And we are built to follow the sun, the circadian rhythm, to be up and awake and active during the day and to go to sleep at night when it's dark. And, when the sun goes down, it gets dark, temperature cools off, a lot of changes happen in the body. You get the release of melatonin from a gland called the pineal gland in the brain. But it's that melatonin that's released at that time, it signals to the body that it's time to wind down and get ready for sleep. That's really why you're getting sleepy.
So we've already got the melatonin. We don't need to be taking more melatonin.
Yeah,
for the most part.
Yeah, I've taken it before. I haven't in years. I think it's debatable.
Yeah.
But no, if we're doing these things consistently, I don't think we need to take a supplement of melatonin. It's really fascinating. During the day, if we are exposed to sun, that's important for vitamin D.
Mm-hmm.
But ultimately, sunlight, one of the things it does is it helps us fight that oxidative damage. And at night, melatonin, it's released. It's higher its level is higher at night. And that helps fight oxidative stress in our bodies at night. And if we mess with that and our sleep cycle's off, we're not managing oxidative stress well.
Last thing, to reduce your oxidative stress?
I would say mindfulness and stress management. A lot of people think stress is the enemy, and we want to manage our lives to completely get rid of stress. I would disagree. I think my personal goal is to become more resilient and to be able to manage stress and walk through it and manage life's responsibilities in a way that doesn't knock me off of my grounding, being centered. And I think should be the goal. And so stress management, there's a lot of ways to approach that. And I think mindfulness practices is key. Meditation, resonance breathing, box breathing, cold therapy is another topic. But yeah, I think there are decent studies that suggest that mindfulness meditation can considerably reduce oxidative stress in the body. So all of these things go together, really.
So bariatric surgery can dramatically improve your heart health, correct?
Yes.
Tell us about that.
Well, another big study released, I think it was in JAMA, major journal, a couple of years ago, showed that in a big group of people undergoing bariatric surgery, that having surgery reduced the risk of heart attack and death by 56% within 4 years.
So are these all morbidly obese people, or
these
not
are people
necessarily?
that qualify for bariatric surgery. So
okay.
People who have risk factors for heart disease.
Uh-huh.
In fact, in this group, it was people, and this study was in people who had diagnosed stable heart disease. So in those people who underwent bariatric surgery, it reduced heart attacks and death by 56% in 4 years. I believe that's a fair representation of
Boy,
that
that's
study.
a lot.
Yeah, it's a huge thing. So, Of course, the question is, how is it doing that? And really, the way I see our program and the way I approach things is we're going after some key fundamental problems, trying to reverse them. Insulin resistance, inflammation, and fundamental to both of those is this oxidative stress thing. And you see it in blood work very quickly after surgery, assuming people are following the program. And part of it is mediated by the nervous system and it happens pretty quickly.
So bariatric surgery is not necessarily just for weight loss, right?
No, of course, no.
Yeah.
It's, the American Diabetics Association, International Diabetic Associations, they've come out, I think it was 2016, they have advocated what they're calling metabolic surgery, which is bariatric surgery for the management of diabetes, type 2 diabetes. And so it's increasingly recognized that these operations do a lot of beneficial things, not just the weight loss. And one of those things is reducing or interfering with that chain reaction that is driving heart disease, and even reducing the risk of heart attack and death in people who have already established stable coronary artery disease.
So it's not, because oftentimes people think about bariatric surgery, or they hear about it and they're thinking, oh, you're going to look good, and or what's the number on the scale today? It's not about that.
Right, and I think I've told you before, I would say most often when I go into an exam room to see a patient, my brain is not even looking at the number that's been recorded as far as
I don't think I've ever heard you focus on that number, ever.
I mean, it's a metric. I understand it. We're all interested in that, but it can be very distracting. But quite honestly, my focus, my goal is something very different in these people. And if we get to these fundamental problems, insulin resistance, inflammation, oxidative stress, this neurological dysfunction, that number on the scale is going to be awesome.
Yeah, which we've already seen with Mona. We've seen with a number of people if they come in and been on the podcast. Right. But that is not the goal. The goal is a long, healthy lifestyle.
Yep.
Feeling good, being there for your grandkids, that kind of stuff, right?
It's all about.
So I don't know if this is going to embarrass you or what this is going to do, but I hear you've been called a madman by other doctors.
Been called a lot of things.
Well, I have too. What is that about?
Well, that's a good question. So I'll say this. We've made a lot of progress in the medical community and in culture in general. In other words, 10 years ago, when I would meet with somebody for the first time, and I'd ask them, look, do you know what carbohydrates are? I would say the vast majority of people didn't know.
They'd probably heard of it before, but they couldn't tell you what it was.
Right. Nowadays, it is pretty rare that someone says, no, what are carbohydrates? So in other words, people out there, non-physicians, they have learned a lot, and we've made a lot of progress with people's understanding of food and a lot of things. In the medical community, we also have made progress. I wish it was faster, but 10 years ago, 8 years ago, whatever, there were a lot more physicians and providers who would call into question what I was recommending for people. Food, primarily. Now, there are a lot more out there that are advocating the same thing. Even had a report through a patient the other day of a cardiologist mentioning the word keto and that they needed to be eating in that way. So we see it in a lot of different fronts, but we're making progress. So I guess 10 years ago, sure.
You're not as much of a madman now as you were 10 years ago.
Fair enough. Hopefully.
So we've covered a lot of information on heart disease. What are the most important takeaways for people?
Everybody can do something. Everybody has the power to do something. You don't have to rely on a doctor. I'm not saying don't get medical care. I'm not saying that at all. But I'm saying be curious, ask questions, be your own advocate, and take the small steps every day that you can do to really interfere with this process that leads to heart disease.
Well, you've simplified it too when you say, hey, it's just about foods, fasting, exercise, water, good sleep, your stress. It's like we all understand that. We can work on those things.
Yeah, I agree.
All right, Dr. Brown, final thoughts. What's going on in that head of yours? Not everything,
good
please.
Question. Human potential. It's all about human potential. Every person is a miracle, has tremendous capacity, and honestly, that is a big part of my thinking and all of this stuff is, you back up, really we want to help people live longer and have a greater capacity to do more while they are alive, to spend time with the people they love, doing the things that they want to do, and to be productive and complete their mission on planet Earth.
And we're doing that. You guys are doing that. Thank you for what you're doing.
Thanks,
and
Rick.
We'll have you back next month.
Deal.